The lungs are vital organs in the respiratory system, responsible for the exchange of oxygen and carbon dioxide between the body and the environment. Here are the key points about the lungs. Anatomy and structure location. Situated in the thoracic, chest cavity. One lung is on either side of the heart. Parts: bronchi, two main tubes, right and left bronchi, that branch from the trachea into each lung. Bronchioles, smaller branches of the bronchi spread throughout the lungs. Alveoli, tiny air sacs at the end of bronchioles where gas exchange occurs. The lungs contain millions of alveoli. Pleura, double-layered membranes surrounding each lung, providing protection and reducing friction during breathing. Lobes. The right lung has 3 lobes, superior, middle, inferior. The left lung has 2 lobes, superior and inferior, to accommodate the heart. Function: gas exchange. Primary function is to facilitate the exchange of oxygen and carbon dioxide. Inhaled oxygen passes from the alveoli into the blood. Carbon dioxide from the blood passes into the alveoli to be exhaled. Breathing process. Inhalation. Diaphragm contracts and moves downward, expanding the chest cavity and drawing air into the lungs. Exhalation. Diaphragm relaxes, reducing the chest cavity size and pushing air out of the lungs. Regulation of pH. By controlling the levels of carbon dioxide in the blood, the lungs help maintain the body's acid-base balance. Respiratory system interaction. Trachea, the windpipe that conducts air from the throat to the bronchi. Diaphragm, a muscle that plays a crucial role in breathing by contracting and relaxing to change the volume of the thoracic cavity. Intercostal muscles, muscles between the ribs that assist in expanding and contracting the chest cavity during breathing. Health and diseases. Common conditions. Asthma, chronic inflammation of the airways causing difficulty in breathing. Chronic obstructive pulmonary disease, COPD. Long-term obstruction of airflow, including conditions like emphysema and chronic bronchitis. Pneumonia, infection that inflames the air sacs, alveoli, in one or both lungs. Lung cancer, uncontrolled growth of abnormal cells in the lungs. Tuberculosis, TB, bacterial infection affecting the lungs. Preventive measures: avoiding smoking and exposure to secondhand smoke, reducing exposure to pollutants and irritants, maintaining good indoor air quality, regular physical exercise, receiving vaccinations for diseases like influenza and pneumonia. Diagnostic tests. Chest X-ray, imaging test to visualize the lungs and detect abnormalities. CT scan, detailed cross-sectional images of the lungs for a more comprehensive examination. Pulmonary function tests, PFTs, measure how well the lungs are working by assessing airflow, volume, and gas exchange. Spirometry, a common PFT that measures the amount and speed of air a person can inhale and exhale. Blood gas analysis, measures oxygen and carbon dioxide levels in the blood to assess lung function.